Thank you, Elizabeth. It's been really a pleasure to work with the Civic Hall Labs team over the last almost year. And it's a real privilege to be able to share some of that work with this audience, which is really incredible. So Mika actually invited me to present a talk like this last year, and I really wanted to do so, but at the time my grandmother was ailing. This is Alice Bloom and Danny. Her funeral was held at a town from not far from here called Elmont in Beth Israel, Temple Beth Israel, which she basically ran for about 30 years. She was the rabbi's assistant, and when that rabbi passed away, she trained the next rabbi, and that rabbi 30 years later presided over her funeral. And in the last years of her life, I tried to talk as much as possible with my grandmother about her life, and I was amazed to discover that in this community, she was basically like the nervous system. If you needed help of any kind, you'd go to Alice Bloom. She would know how to get food assistance, help with Social Security and Medicaid. She could help you find a lawyer, and if she didn't know, she had a list of people who knew. And she'd ask me about my work, and I say, well, Grandma, a lot of people today don't have someone like you that they can count on. And so I'm trying to make this information about helpful resources available everywhere, even like right in Google. And she didn't ever figure out what MySpace book was, but she did know what Google was, and whenever I said that, she'd always reply, well, my Shana Punham, back in my day, I was the Google. My sister and I still laugh about this with a tinge of sadness, because not just because we've lost our grandmother, but more importantly, there's a sense of loss for all of us in this story. This is my sister. My grandmother would want you to know that she's grown up to be a beautiful woman. She's also a public defender. She helps poor people facing criminal charges in court. And she really enjoys litigation. But she tells me that the hardest and most important part of her job is more like social work. For her clients to be effectively represented in court, they need to have their basic needs met outside of court, and she's often the only person in a position to help them do that. And here's what she says about that. She says, I'm used to trusting whatever I find, and I find whatever I want on the internet. But when it comes to things that are really needed by people who are really in need, things like shelter and childcare and transportation, Google is like a ghost town. It's almost like the internet is making it harder for people in need to find help. And I have a firsthand view of why that is. So this is Stacy Johnson. I worked with Stacy Johnson at a place called Bread for the City in Washington, D.C. They serve low-income D.C. residents with the largest food pantry in the city, but also a large medical clinic, and they have a posse of lawyers, and they have a posse of social workers. And Stacy and her social workers, the work of collecting information and referring people to services is so important and such a hard part of their job that about 10 years ago, she built a resource directory database in Microsoft Access, where she keeps track of more than 500 organizations providing more than 1,000 services across the DC area. And as a result, her caseload actually went way up because people came to trust Bread for the City to help them figure out where else they needed to go. And basically, Stacy and her social workers were doing what my grandma was doing for the Jewish community of Elmont at scale across an entire city. Now, here's the thing. Other organizations would come to us and ask us for this database, and we would happily comply. We'd hand out copies. And they'd use those copies to do community asset maps or community resource locator websites and printed manuals. And as soon as that data left our doors, it started decaying and it was incompatible. And this is what that basically added up to. We counted as many as 12 different resource directories across DC. It got to the point where I gave up trying to update our own information and all of them over and over again. And eventually I realized that this is not a local problem just in DC. This is an endemic, systemic pattern. In cities and across the country and across the world, this information about who's providing what to whom, information that should be a public good, freely available and abundant, is more like a commodity. Scarce and costly and redundant. And that pattern is the source of misery and waste and chaos for people who need help, for people who are trying to help them. It stymies the ability of people like you, civic technologists, to build tools that can help them. And it also is hard for decision makers, funders, and policymakers to effectively evaluate how our safety net is doing at actually meeting communities' needs. It doesn't have to be like this. We can do better. And by better, I don't mean that we can build a killer app that would eliminate the need for people like Stacy and like my grandmother and their local knowledge. By better, I mean we can build an information infrastructure for the 21st century safety net that is the bedrock of a whole ecosystem of apps and case management systems and hotlines and so on. Any kind of information channel through which people might try to find help. So that's why I started Open Referral. We're building a world in which this information about who's providing what services to whom is easy to find in any number of ways, like electricity, like water, like the World Wide Web. And just like the World Wide Web, we started by developing an open data format that can enable any information system to exchange this data in real time with any other information system. And we're using that format to broker collaborations in community pilot projects across the country and even around the world, where people like Stacy and even like my grandmother and my sister are collaborating with technologists such as yourself, with government officials, with other civic leaders, to imagine new ways to make this information available in their community in a reliable and sustainable way. Again, that doesn't just mean apps, but we do have those. This is LinkSF, which was built by Zendesk in San Francisco. This is HelpSteps, which was built by the Boston Children's Hospital. This is Ohana, which was built by Code for America, who co-sponsored the launch of the Open Referral Initiative. And these are just the initial fruits of an ecosystem that we want to grow and become essentially the internet of help. So I'm excited to say that Civic Hall Labs is like the ideal partner for this work. They're leading the charge here in New York City, and they're cultivating our framework for deliberative, participatory research and design, a process by which we locate people and communities, not business models and apps, at the center. So you can learn more at openreferral.org. I've just posted an announcement of the Civic Hall Imagination Fellowship, and there's a video of me talking a lot faster and conveying a lot more information that you can watch. And if you're interested in joining one of our pilot projects or starting a pilot project in your community, you can come talk to me. You can send us an email on the site. And I look forward to coming back next year, hopefully, and sharing more information about the progress that we've made towards transforming the safety net for the 21st century. Thank you.